for IT to start broadcasting the meeting. So the meeting will start in approximately 30 seconds to a minute. Thank you.
Afternoon, Chairperson.
Right, good afternoon to you all. A very warm welcome to the Provincial Parliament of the Western Cape's Ad Hoc Committee on COVID-19. I'd like to welcome the members from the various political parties present. I'd like to welcome the organizations and individuals that will be providing us with oral submissions today. I'd also like to welcome members of the public and the media that are tuning in on YouTube live as we speak. My name is Mireille Wenger and I'm the chairperson of this ad hoc committee. Let's start with some apologies. I have received an apology from Honourable Deirdre Bartman, and Honourable Ricardo McKenzie will be standing in for her. Are there any other apologies? I see Honourable Heron.
Yes, please, Chairperson. I will be departing early at around 3:30.
Thank you. We'll take note of that. Also, some of the representatives of political parties may be joining us slightly late in a few minutes as they're still making their way to the building from the memorial service of Mr. Mayor that we've just attended. Are there any further apologies? If there are no further apologies, I'm going to get into the rules of engagement for virtual meetings. Members and participants have all been muted at the start of the meeting. This is to make sure that we don't have background noises. I'd ask members to please flag any points of order using the chat function or otherwise using the raise your hand function. We ask that video and audio is turned off, especially considering that we have a large number of participants today. It helps us to keep a stable line. We do, however, ask that if you are speaking or presenting to please do use your camera and of course your microphone. Once you have concluded, to then turn off your microphone and your camera. We also ask that if you are sharing a presentation, that once you have concluded the presentation, to please unshare the presentation off the screen. So with that out the way, we're going to now continue this committee's public engagement program. We are going to be hearing from various individuals and organizations today. We'll be hearing from Professor Eric Atmore, the director at the Centre for Early Childhood Development. We're going to be hearing from Ms. Lianne Hilleby, who is a COVID-19 survivor. We're going to be hearing from Ms. Daniela Ellerbach from the Freedom of Religion South Africa NPC, and from Ms. Doreen Gora and Ms. Kirsten Peterson from the Detention Justice Forum. We will then be hearing from Professor Lucas Munting from the African Criminal Justice Reform at the Dalla Omar Institute, and then from Mr. Sikulele Monakili, who is the Manager for Food and Security Training at Elite Labantu. So these organizations or individuals requested to provide oral submissions to the committee during the public engagement process, and so we look forward to hearing from them. We've asked each participant to speak for no longer than 10 minutes, so I would ask if you would kindly stick to the time limit so that we can hear all the voices here today. Once we've heard from everyone, we will then have a question and answer session from the members, and then the members will stay on so that we can deliberate on the grid for public participation, as well as finalize some minutes. So with that out the way, we'd like to welcome all of you, and we look forward to hearing your submissions. We're going to start with Professor Atmore, the Director at the Centre for Early Childhood Development. Good afternoon, Professor. A warm welcome to you.
Good afternoon, and thank you for the opportunity. Afternoon to the chair and to all the members. I've got 10 minutes, but I'm known for my brevity, so I'll take 6. The consequences of the lockdown on children, on parents, and on ECD workers across the province, it has been significant. As recently as yesterday, another child was shot dead in Parkwood. And all this links back to the lockdown and the way we treat our children. During the lockdown, children were required to stay at home, often in dangerous environments where they were and still are at considerable risk to themselves. In the Western Cape, some 270,000 vulnerable children depend on attendance at an ECD centre each day for their early learning, for their safety, and for their main meal. This has not been available for a number of months, and now that ECD centres are able to open via the Gauteng High Court decision, it's shown us in the field that tens of thousands of children, there's been an increase in hunger and malnutrition, as doctors are now telling us. A rapid survey was conducted earlier this year to look at what's happening in early childhood centres. And the results, 4 main points. In 99% of ECD centres, parents had stopped paying fees owing to the lockdown. 83% of ECD centres were not able to pay full salaries or even partial salaries to their staff over the lockdown. 96% of centres reported that the ECD centre income was not sufficient to pay for operating costs. And 68% of ECD centres were concerned that they would not be able to reopen after the lockdown. The Centre for Early Childhood Development did a rapid analysis of 150 centres about 2 weeks ago, and we found that just on half of ECD centres are open and functioning. But in those centres, the number of children has dropped to about 10 to 20%. So the centre has been decimated. If we look at the big picture, there are about 4,500 ECD centres across the province. They employ about 23,000 ECD teachers, and they provide quality early learning for about 270,000 children each day, or they certainly did prior to the lockdown. Teachers are not getting paid, and yet working parents need a secure and safe environment for their children. Now that under level 2, most workers are back at work. So the impact, in our professional opinion, is that about 500 to 800 ECD centres in the province will close. Some 4,000 to 6,000 jobs will be lost, and 50,000 vulnerable young children will not be getting those early learning opportunities and their nutritious meal every day. Continuing to look at the big picture, the early childhood sector contributes about 3 billion rand to the Western Cape economy this year. The result of national social development delaying the opening of ECD centres will be felt for years to come. It'll be felt in a number of ways, but it's not going to finish when the lockdown is over. It'll be felt for years. With this as background, we strongly suggest that the Provincial Treasury make an allocation to the Provincial Department of Social Development to support the 2,000 most vulnerable ECD centres, to support them to open. By this, we mean some startup funding to get the centre operational, and then to provide funding for the personal protective equipment that is so essential. We are well aware that the province is the only province in the country that at this point has distributed funding for PPE. This was a 10.2 million rand allocation, some of it which came from National Treasury, and it's costed at about 4,000 rand per centre. So the Western Cape has done something, whilst the other 8 provinces have done virtually nothing. But it is our contention that this is far too little. 4,000 rand barely gets you a thermometer one of those gun type thermometers, and it barely gets you the sanitizers and all the protective equipment that is needed. So PPE is only one aspect of reopening this sector that has been decimated. We're asking the Provincial Treasury to support 2,000 of the poorest ECD centres to function optimally by making the current ECD subsidy, which is 16 or 17 Rand per qualifying child per day. We're not sure because there are different figures given to us. And that every single ECD centre in the province, whether they're registered or not, receive this subsidy. The reason for the unregistered centres is that these are the centres that are most in need and that service the most vulnerable children. So if adequate PPE and a start-up or restart subsidy was provided to ECD centres, we estimate that the cost will be about 490 million Rand. Now, this is a small cost to ensure the jobs of 6,000 ECD teachers, 99.9% of whom are women, and to ensure meals and early learning for 270,000 vulnerable children. It is a minuscule amount. It's less than 1/10 of 1% what the president announced as part of the recovery package. The late Oliver Tambo said that a country that does not value its children does not deserve its future. The Western Cape government and officials and this subcommittee must at this time ask the question, are we servicing our children and serving them properly? Do we deserve our future? So in conclusion, we really have a devastated early childhood development sector. Children are not being brought back to the sector because parents don't have money. The centers are not paying their staff. There's no nutrition available for young children. And it really is a situation which, besides being felt at the moment, is going to be felt from years to come, unless there's an injection. And the Western Cape government, as the leading province in early childhood development, we urge you to rethink your support and your funding of the early childhood sector. Thank you very much.
Thank you very much, Professor Atmore, for your submission and for those insights. As mentioned earlier, we will have a Q&A session once we've heard all the submissions. I'd ask Ms. Wenger if you would turn your camera off, please. I see you noted as Leah Wenger. If you'd please turn your camera off, please. We'll then move on to our next participant, Ms. Lianne Hilleby. I hope I've pronounced that correctly, who is a COVID-19 survivor and who would like to share some insights with the committee. Ms. Hilleby, are you on the line?
I'm on.
Good afternoon and welcome. I'll hand it directly over to you. Thank you.
Chairperson.
Yes, is that a point of order, Honourable Mackenzie?
That was Ms. Hilleby, that was Ona.
Yes, no, Leah Vega's my artist name, sorry.
My apologies. You're welcome to turn your camera on as you provide your input. Thank you very much.
Hi, good afternoon, everyone.
Good afternoon. Thank you for joining us.
Pleasure. Thank you for having me. So I am a COVID-19 survivor as well as an artist who has been, obviously, as everyone knows, affected by the whole pandemic and since March, obviously not having an income. My experience was obviously, I mean, I didn't expect getting the virus. We got the virus. And luckily for me, I mean, I had it more severe. So it took me about 3 months to be officially cleared as recovered. While in quarantine, obviously, not having an income was a big thing for us. I mean, I had no medical aid, no income to support the going to doctors, going for blood tests, going to hospital, and even continuing having to go for lung checks because of the damage that was done to my lungs. So my concern there was, I mean, as artists, we have no income, no relief funding as yet. The only thing I have received thus far, thankfully, was that I applied for, obviously, the medical relief fund, and that was paid out, which I'm very grateful for, because that covered my PathCare bills and my medical bills. Yeah, I'm just basically, we are asking as a whole is when do we hear back about the relief funds? How do we apply? We've applied, there's a criteria, we've submitted everything that's required of us, and still there's no feedback. You get told that there aren't enough donations. So we get put in a line. I don't know. We in the dark. We don't know as artists what's the way forward. What do we do in this time? I mean, we've got our reality is that we can't afford to live. You know, we've got letters of demand to move out and vacate our current premises. We've got letters from lawyers saying that our cars will be repossessed. And that is our fear right now, is that even though we getting relief fund, the maximum would then say, 10,000, and that doesn't cover half of what we've accumulated in this time since March, obviously not earning. As an artist, obviously being self-employed or noticed as self-employed, how do we, if we get evicted from our homes, how do we reapply for a smaller place where we can afford maybe, or an outbuilding? Those are the concerns that we as artists are having. Many of my colleagues have been moving home, married couples moving home in with their parents because they just can't pay the rent. And, that's my concern is, what do we do going forward? Level 2, yes, we understand that, slowly the economy is opening up, but for the artists, nothing's being said. Can you hear me?
Yeah. Thank you, Ms. Hilleby, for sharing those difficulties with us. Does that conclude your input for now, or were there further things?
No, I'll listen in further.
Thank you very much. And this pandemic has certainly brought some very difficult times to very many people. And thank you for coming today to share some of those difficulties with us. We're very grateful to you. I'm now going to ask Ms. Daniela Ellebeck from the Freedom of Religion South Africa to make a submission on behalf of that organization, please.
Thank you. Honourable committee members, thank you for giving Freedom of Religion South Africa, 4SA, the opportunity and privilege to address you this afternoon. My name is Daniela Ellebeck, and I'm an attorney and the legal advisor for 4SA, a legal advocacy group working to protect and promote the right to religious freedom granted to all South Africans by our Constitution. Now, 4SA did indeed submit to this honourable committee, and this was the submission that we sent in on the 11th of August. However, given all the many changes that have happened since then, and to keep up with recent developments, my presentation today will focus on how the religious community has been impacted by the lockdown regulations, taking into account current developments. On this issue, on a national level, we represent religious leaders and organizations representing 18.5 million people in South Africa, including over 10 million from African indigenous and spiritual churches from a cross-spectrum of denominations, churches, and faith groups. During a recent meeting with our constituency, various senior religious leaders expressed concern that the national government's response has been unreasonable and unfairly discriminatory against the religious sector. Many observed that the worst of the pandemic has evidently passed, with infection and death rates thankfully in a steady decline, and the temporary emergency hospitals set up by the government to treat those infected now dismantled. Despite this, the stringent regulations imposed on churches and other places of worship 3 months ago, which were promulgated on the 28th of May, still remain in place. At the same time, we note that casinos are allowed to operate at 50% of the venue's capacity. Cinemas and conference centres are allowed to meet in multiple venues on the same premises, each limited to 50 people, whereas religious premises are limited to a single meeting of 50 people. Shopping centres are again running at full capacity. Car parks are full. Taxis run at 100% capacity, as do airplanes. Drive-in services at churches are not allowed by government, while drive-in cinemas are selling tickets for as many as 800 people at a single gathering. It has also been reported that the request of health and fitness clubs to be allowed to operate at 50% of capacity is also being favourably considered by government. In these circumstances, the stringent restrictions on religious gatherings are increasingly seen as an issue of fairness and freedom. While people are allowed to make their own health choices when it comes to the transport they take and the shops, restaurants, shebeens, and even casinos they visit, the same discretion is not granted when it comes to being allowed to visit a church, mosque, synagogue, or temple. These issues are elaborated on in our submission in front of the committee. To this end, 4SA was invited to meet with President Cyril Ramaphosa last week on Wednesday, the 2nd of September, to discuss the impact of the lockdown regulations on the religious community. During this meeting, 4SA, along with various interfaith leaders, requested that appropriate adjustments in the regulations and directions pertaining to the religious gatherings be made to reflect the entire country's move from level 3 to level 2. In particular, we requested that religious gatherings be opened up to at least 50% of the available floor space, subject to the normal health, sanitization, and physical distancing protocols that apply. We advocated that such adjustments will go a long way in showing the religious community that the national government does indeed recognize the cooperative and responsible way in which the religious community has gone about reopening its places of worship. Further, this will affirm that government does indeed trust religious leaders to continue to take responsibility for the people under their care. We are currently awaiting feedback from the Office of the Presidency in this regard. As pointed out in our submission to this committee, the issue is not that religious communities must reopen their venues. There is zero obligation on the part of any religious organization to reopen for public gatherings, just as there is no obligation on any member of a religious organization to attend such a meeting. Rather, it is a growing belief that it is neither reasonable nor justifiable for government to treat the religious community with a different standard to the rest of the economic sector. Furthermore, 4SA wishes to point out that, as per the national government's website, the idea behind adopting the differentiated alert level approach was to allow different alert levels to be declared nationally, provincially, in a metropolitan area, and even in a district, when taking into account A, the epidemiological trends of COVID infections in that area, the area's health system's capacity to respond to the disease burden, and any other factor that would influence the level of infection, hospitalization, and mortality. In this context, it's only fair to ask what the rationale is for the Western Cape province remaining at alert level 2 when, firstly, it appears that the Western Cape has passed the curve and should, if not be unlocked entirely, at least be at alert level 1, which is the alert level characterized by a low COVID spread with a high health system readiness. And secondly, the data showing that the second wave of COVID infections only occur in places which have not seen a significant level of infection. This is the case in Italy, where the statistics show that the virus is now predominantly affecting the southern regions of the country, as well as, for instance, New York City, which was the worst hit in the USA. However, in the 30 days since the city has reopened, infection rates have dropped to below 1%, and 0 deaths were reported this past weekend, versus a peak of nearly 800 in a single day at the start. This is evidence that once the virus has burned through a population, people have either caught it and recovered and developed an immunity, or tragically died. In this context, a growing number of religious organizations and faith groups have told 4SA that they are considering the possibility of legal action as a last resort to ensure equal treatment of the religious community in comparison to other sectors of the society and to enforce their constitutional rights. We trust, however, that this will not be necessary and that the President will soon revert with positive news regarding the further reopening of churches and places of worship. In conclusion, Honourable Committee members, this sincere petition and appeal of the people represented by 4SA in this matter is that the Western Cape government would immediately consider and engage with the national government regarding moving the Western Cape province to alert level 1 and/or no lockdown. In particular, we would request the Western Cape government to support the appeals of interfaith leaders to permit the religious community to resume gatherings, with all the important social distancing, hygiene, and sanitization protocols in place to at least 50% of the capacity of their buildings and facilities. ORSA is cognizant of the warning by the Deputy Minister of Health that experience has shown a resurgence of infections in confined and crowded areas where there is no physical distancing or masks. However, surely religious gatherings should pose no greater risk than any of the other sectors of society, and potentially even less in circumstances where stricter protocols apply to religious gatherings than, for example, shopping malls or restaurants. ORSA hopes to be able to revert to our constituency with a positive report once its committee has given the urgent and hopefully favourable attention to this request. Thank you again for the opportunity.
Thank you very much, Ms. Ellerbeck, for that submission on behalf of Freedom of Religion of South Africa. We now are going to hear from the Detention Justice Forum. We have Ms. Gora and Ms. Peterson present. Are you both going to be presenting?
Yes, we will split our presentation into half between the two of us.
Perfect. Please be welcome. I'll hand straight over to you.
Thank you very much. Good day, honourable members. Thank you so much for providing us with the opportunity to make this in-person presentation. My colleague and I are here on behalf of the Detention Justice Forum, or the DJF for short. The DJF is a civil society coalition of non-governmental organizations and individuals working to ensure that the rights and well-being of those who are detained are respected and upheld. Our submission with slight amendments to statistics to update them to the current state is as follows. We as the DJF have been concerned about the devastating effect the spread of COVID-19, as well as the government's response thereof, may have on people in places of detention. We have vigilantly monitored the government's response to the pandemic as far as detention institutions and facilities are concerned. Furthermore, not only has the DJF made numerous attempts to engage with the relevant government departments to get information regarding their plans vis-a-vis the situation in detention facilities, but we have also made recommendations that could assist the government in controlling the spread of the virus in detention facilities, while at the same time remaining committed to their mandate to ensure that the rights, safety, and well-being of people in detention are upheld. At the time of making our written submission to the committee on the 12th of August 2020, the statistics on COVID infections amongst SAPS members we shared stood at a little over 7,000. By the 14th of August 2020, the Minister of Police reported that over 14,000 SAPS members had tested positive for the virus, and the Department of Correctional Services has reported over 6,800 positive cases to date among inmates and staff. What is also deeply concerning to us is that statistics for other places of detention, such as police cells, Lindela Repatriation Center, child and youth care centers, and military detention facilities, for example, are not as easily available, and it is almost impossible to know what the situation is in those facilities, or if any oversight or monitoring of the facilities is taking place. While we appreciate the preventative efforts that the government has taken to curb COVID-19, we have also noted the government's reluctance to disseminate information speedily and regularly, not only to people in detention, but also to civil society, despite numerous requests for information by organizations such as ours. From the start of lockdown, not much information on COVID-19 protocols in detention facilities was immediately available in the public domain, besides the announcement of immediate cessation of visits to such places. In this regard, there was a general failure and lack of transparency on the part of some government institutions responsible for the detention of persons, with no effort being made to immediately make publicly available the directives or standing operating procedures on managing the spread of COVID in the facilities. When the DCS eventually made public its strategic operational plan, we noted that it was almost exclusively concerned with health issues and did not touch on human rights issues that are not health related but are equally critical, such as those of safety, justice, and effective oversight. The measures that the DCS has implemented during this period seem to have been publicized on an ad hoc basis, that is, responding to issues as they arose with no engagement with other stakeholders such as civil society, people in detention and their loved ones, and in some instances, according to media reports, the staff itself. This lack of official information has had a significant impact on public perception of government departments responsible for withholding people's liberty and the right to access to information. It has also impeded civil society organizations' ability to engage with, provide assistance to, and hold government to account, and has led to much anxiety and, in some cases, fear-induced violent reactions on the part of those in detention. We made numerous requests to the Ministers of Justice and Correctional Services, the South African National Defence Force, the South African Police Service, Home Affairs, and Health to furnish us with operational plans in addressing COVID-19 in South Africa's places of detention, as well as the department's health plan, especially as it relates to quarantine and the treatment of non-emergency medical needs during the pandemic. Unfortunately, these efforts were to no avail. We greatly supported the Minister of Justice and Correctional Services' eventual decision to release 19,000 low-risk incarcerated persons on parole as a way to reduce the overcrowding in South Africa's prisons. As you know, and as the Minister himself has stated on numerous occasions, overcrowding is the primary driver of the spread of diseases in prisons. We were, however, dismayed by reports made on the 24th of June 2020 to the Portfolio Committee by the Minister that the process of releasing the detainees had bottlenecked the system. Given how long it took for the ministry to reach the decision to release inmates so as to reduce overcrowding in DCS facilities from the time of national disaster was declared, we expected the ministry and the department to have been preparing for the process in the lead up to the decision to release people. I'll hand over to my colleague, Chris.
Thank you. Good afternoon.
Good afternoon. Thank you for allowing me this opportunity. I'll try to be as brief as possible. My submission will focus on two problematic areas pertaining to government's response. The first is the enforcement of COVID-19 measures and the criminalization of COVID-19 transgressions. And the second deals with detention oversight and monitoring during COVID-19. So with regards to the enforcement of COVID-19 measures, we welcome the minister's decision to release low-risk incarcerated persons on parole as a way to reduce overcrowding in South Africa's prisons. But we are, however, equally concerned about the high number of arrests during the same period, which actually has a counter effect on ensuring that the overcrowding rates within detention facilities are reduced. The COVID-19 regulations that are in place to curb the spread of COVID-19 have created new sets of minor offences which previously did not exist. Having people go through the criminal justice system through arrest and detention for violating minor lockdown measures is counterproductive. It exacerbates the public health problem as it exposes people to a heightened risk of infection due to the unsanitary and overcrowding in police cells and remand facilities. It also exacerbates the pressure on the already strained criminal justice system. The imposition of criminal sanctions for less serious non-violent COVID-19 transgressions will have severe consequences for persons in the future, as they will have criminal records. They will likely be denied access to job opportunities, and this may prevent them from providing for their families. This will further exacerbate the plight of the poor and the vulnerable and increase the burden on the state for grants and services. Whilst we acknowledge the Deputy Minister of Justice commitment during the Portfolio Committee on the 18th of May 2020 to introduce a judicial matters bill preventing persons from receiving criminal records for such transgressions, it remains unclear as to when this will happen and what the bill will look like. This in turn creates huge long-term problems for individuals, and we are deeply concerned about that. Lastly, we are also concerned about detention monitoring. What is concerning to us is that when the moratorium was placed on visits to all places of detention facilities by the state of disaster regulations, this moratorium extended to the visits by the detention monitoring body, the Judicial Inspectorate for Correctional Services, independent correctional center visitors. The initial state of disaster regulations prohibited all visits to detention centers, and this prevented them from fulfilling their oversight mandate, and this is to inspect prisons and to attend to complaints of inmates. The Judicial Inspectorate's ICCV remained excluded from essential services under the regulations, which only made provisions for the DCS officials and other Chapter 9 and constitutional institutions. Directors directives allowing explicit visits by the Judicial Inspectorate's ICCVs were only published 3 months after the initial lockdown was imposed, and that was on the 22nd of June 2020. We remain critical of government's initial response to drastically curtail the duties of oversight mechanisms and for such an extensive period of time, as this could have significantly jeopardized the safety, well-being, and the rights of people in detention. The decision was to the detriment of ensuring that the rights and well-being of inmates are monitored. And we are also equally concerned about the limited information available on the status of monitoring at immigration detention facilities, police cells, and child youth care facilities. We have tried to engage the Human Rights Commission to get clarity on the extent of monitoring of detention by them, as they are the designated national preventative mechanism, but we have been unsuccessful in getting a response on the extent of monitoring actually carried out during COVID-19. Thanks for the opportunity, and we look forward to engaging with the committee in the future as it relates to upholding the rights of people in detention. Thank you.
Thank you very much to you both for that extensive submission to the committee. That was the submission from the Detention Justice Forum. Thank you very much. We then move on to our second last oral submission today, and that is from Professor Lucas Munting, who is representing the African Criminal Justice Reform from the Dalla Oma Institute. Good afternoon, Professor. Are you on the line?
Good afternoon. Thank you, Chairperson. Can I proceed?
Yes, please. Over to you.
Thank you. This submission overlaps to a large extent with that of the Detention Justice Forum, but I wish to emphasize a particular point. And it concerns our obligations under international law, and I'll explore on that later. And it concerns places of detention, not only prisons, but also police stations, but more specifically relevant to the province, those places of detention that are the responsibility of the provincial government, so those facilities that fall under the Department of Social Development or the Department of Health, for example. I think we also need to be extremely mindful that a lockdown of this nature may happen again, and that we need to be better prepared for it next time round. And I think the events over the last 5 months have shown us a couple of lessons to be learned. I think it is also important to recognize, and the previous presenters have alluded to this in some part, that it's not only health rights that are affected by or were affected by the COVID-19 lockdown, but civil and political rights and probably socioeconomic rights were also impacted. Our concern, or my concern here, is with the rights of detained persons. And then in terms of the submission, we made a few points to highlight. South Africa is a party to the optional protocol to the Convention Against Torture. We ratified that middle of last year, and we are required to designate a national preventive mechanism that will then have the responsibility to monitor compliance with the optional protocol. And the South African Human Rights Commission was consequently designated as the national preventive mechanism, with a very express mandate to monitor conditions of detention and the treatment of people deprived of their liberty. So very shortly before the lockdown, the UN Subcommittee on the Prevention of Torture, the SPT, issued a public advice to all national preventive mechanisms across the world, though from countries that are states parties to the optional protocol, concerning the monitoring of places of detention during the lockdown, because that was by then evident that it would happen. And the key advice was that monitoring should not stop, and that the lockdown should not serve as an excuse for rights violations in places of detention. So in response to that we, and I say here, the Detention Justice Forum, used the public advice from the SPT and developed a monitoring tool to assess the performance of the designated national preventive mechanism, and in this case, the South African Human Rights Commission, in fulfilling its obligations under the optional protocol. And we've attached a copy of that monitoring tool with the results as of at the end of May to our presentation. I'm not going to go through that. Nonetheless, it is our view that there was a fundamental failure in the drafting of the regulations concerning the lockdown, that the independent correctional center visitors of the Judicial Inspectorate for Correctional Services were not included as an essential service, and that monitoring consequently stopped. It's also apparent that the monitoring of other places of detention, such as police cells, also fell through the cracks. We've not been able to establish with any certainty whether other places of detention, such as those falling under the Department of Social Development, were covered by other monitoring mechanisms, but as far as I know, that didn't happen. Our observation is that the Judicial Inspectorate tried as best it could to engage in monitoring, but the situation only started to improve by mid-June. And to this day, it remains unknown, as I said earlier, who was monitoring the other places of detention and how complaints were recorded, followed up, and resolved. So we circulated the monitoring report on 3 occasions to the Human Rights Commission in its capacity as National Preventive Mechanism, and we are still awaiting a response from the Human Rights Commission. So I think it's fair to say at the first opportunity that the NPM had to function under the obligations under OPCAT. It failed to do so. And I think that is something that one needs to rectify sooner rather than later, so that if we do have a lockdown or restrictions of a similar nature again, that we are well prepared and that monitoring can continue. Thank you very much.
Thank you very much, Professor. You know, what you say is true. I mean, if we look at what's happening in the Northern Hemisphere, where they might have to go into a second round of lockdowns, you know, it's better that we are prepared. We then move on to our final submission today from Mr. Monakile, who is the Food and Security Training Manager from Ecd Labantu. Good afternoon, sir. Very welcome.
Good afternoon. Thank you very much for having me. I hope that I can be brief with the issue of food security, which is one of the biggest issues that the country has been facing currently. The COVID-19 pandemic has hit South Africa and affected many people in the country. Even those who were not susceptible to the outbreak have had to endure with the quarantine measures as placed by government. This has led to a massive increase in violence against women and children, and also in poverty and food insecurity. In regards to food insecurity, there have been many organizations and corporate partners which seek to diminish the overall scourge this virus has caused, yet the need far surpasses the support that has been readily available. But with each milestone, we seek to alleviate the social and economic scale by which the COVID-19 has affected our communities, and with the help of the private sector, government, and other NPOs who have brought much needed relief to families and homes who have been the most affected, the vulnerable groups negatively have been affected by this pandemic. As an organization that strives for the betterment of women and children, Ecd Labantu had tasked itself with ensuring people have access to a daily meal when it became evident to what extent the issue of food security was. The issue of food security affects the most vulnerable and falls in line with our organization's core mandate. Through Ecd Labantu's comprehensive food security program and food distribution models, we strongly focus on strengthening community organizations for social health and local economic development. Ecd has created and implemented methodologies that promote a holistic community-driven approach to development by capacitating communities to become food secure through job creation initiatives, food support programs, and extended counseling and rehabilitation services for vulnerable women and children affected by domestic violence and the pandemic at large. The objectives of Ecd Labantu's comprehensive food program include ensuring access to food for poor and vulnerable members of our society, improve nutrition security for citizens, improve food production capacity of households, develop market channels for emerging farmers and communal gardens through bulk government procurement programs of food and private sector markets, and fostering partnerships with relevant stakeholders within the food supply chain, and enhance safety nets and food security management systems. COVID-19 has swept through many areas of the Western Cape, which is known as a hotspot. In terms of the reach, we had hoped to ensure that we went further into the rural areas as we felt that they are in desperate need of assistance. There were many calls made to the organization by other organizations throughout the province, and we had to ensure that we can accommodate all the people who had enlisted for help. But one has to recognize that assistance can only go so far, and in the initial stage, we had worked with Solidarity Fund and the National Department of Social Development, where we were called upon by the National Department and Old Mutual, and also ensure that this assistance reached many people that we could have that needed the assistance through our basic food program. Through the existence of the program, we also went through to areas such as the Overberg region, which the district remains a place where agricultural activities are dominant, mostly through fruit and citrus farming. But as it stands, it is also rife with poverty and inequality, where the people have had to make their own means to survive. The issue is the COVID-19 has brought about a lot of farming areas to come into disregard, as these farmers were dependent on the work necessary upon the farms. Plus, with the fact that was the issue of it is the beginning of the late harvest, meaning that a lot of off-seasonal workers were also still not working. Add that with the pandemic, it meant that a lot of people were suffering under these conditions. The Cape Winelands region also has extremely been hard hit by the COVID-19 due to the fact that the vineyards and wineries have had to close during this period, and even those non-seasonal workers had no gains, and permanent workers had to be retrenched. The wine industry is the backbone of the Western Cape agricultural GDP, and without a proper source of income, people in the area are doomed to have dismal opportunities. The Cape West Coast is also similar to the Cape Winelands, but the area is also susceptible to an arid forecast due to the fact that it forms part of the Karoo, and thus it is a dry and arid area with limited rainfall. The Cape West Coast also suffers tremendously from alcohol and drug abuse, with 1 in 3 people addicted to substances and 1 in 2 addicted to alcohol. This is due to the history of the area and the payment of laborers in alcohol, aka the dope system. But as well, throughout the city of Cape Town, the Cape Metro has been one of the highest municipalities to experience food insecurity according to the Stats SA General Household Survey. There is also a plethora of outside factors that contribute to the needs of the communities but are barely addressed. Due to the rampant violence, drug-related crimes, major influx of the population, and a shrinking job network, there is a sense that we have not scratched the surface in regards to alleviating the food crisis in the Western Cape, as there are many areas such as Delft, Mitchells Plain, Mfuleni, etc., that have little or no access to food relief due to the spike of violence aimed at those who were bringing food relief to those areas. But also, there's a majority of citizens living beneath the poverty line, and this needs to result in an expansion of these areas through a positive engagement with both national, provincial, and local government to ensure a streamlined approach in how we affect the relief needed within those communities. Also, the fact that the COVID-19 pandemic has highly affected women and children in the form of gender-based violence. The emergence of the coronavirus pandemic in South Africa has exacerbated the pre-existing social disparities and inequalities in South Africa. And this meant that those living in poorer communities were more disproportionately affected than those living within the affluent communities. Women in the rural areas and township communities were adversely affected as a result of their poor economic status. They could not leave their partners, and at the same time, there was an increased difficulty in accessing support services, the courts, and even the police. And abusers exploited this inability for women to call for help or escape this place. Many survivors are placed in a predicament and having to choose between two evils: the COVID-19 pandemic or endure continued abuse from their partners. We were hoping that through this engagement and through how us as civil society, the networks of the private sector and the public sector can ensure that we are trying to exacerbate the need for people to come support those in need. The fact is that COVID-19 and gender-based violence have seemed to gone hand in hand, similar to food insecurity and the pandemic. And we need to ensure that organizations such as Elita Labantu, Food Forward SA, and other organizations that are bringing food towards the communities can help at least alleviate a portion of the issues that many people are facing. And we can then focus our attention on ensuring that the same resources and the same passion that has been shown by government in addressing COVID-19 can be used to address the other pandemics that we face on a daily basis, which is gender-based violence and food insecurity. With that being said, we hope that through these engagements, we'll be able to think of positive solutions and work on way forwards as we all grasp with the nature of the issues that are at hand. Thank you very much.
Thank you very much for that submission and insights. I'm sure that there are a number of questions from the members following the 6 submissions that we have just received. Just to explain to the individuals that are joining us today, how we're going to follow our usual system where I will recognize each political party in turn, and they'll be given 3 minutes to pose questions. So if you would please be able to write down any questions for you, and then we'll have the answers once each party has had an opportunity to pose their questions. Right, so let me just get my clock out. I'm going to then start as usual with the DA. Are there any questions from the DA, please? Before we do that, if I could just ask the members if you would kindly indicate to which organization or person your question is directed, or if it's to several, if you just indicate that so that they can be aware that the question is to them. Thank you very much. All right, DA, any questions from the DA, please? Okay, I see Honourable van der Westhuizen, followed by Honourable Mackenzie. So over to you, Honourable van der Westhuizen.
Yeah, thank you for the opportunity. Thank you for the presentation. It was really enlightening. A lot of information was shared with us, and I just again realized the value of these kinds of public engagements. My question is to Ms. Hilleby regarding support for artists. Did she consider applying for support? Did she perhaps then apply? To which support funds did she apply? And why does she believe that the applications then were turned down? I do know that there were support given to artists, both by national as well as from provinces side. But I also do know that apparently those applications were fully ascribed to within a matter of hours. But if she could just indicate, you know, what has been her session? Was it a lack of information? Was it, you know, why come that she believes that she couldn't qualify for support? Thank you, Chair.
Thank you. I see Honourable Mackenzie. There's still a minute and a half left of the DA's time.
Thank you, Chairperson. Chairperson, my question would be to Professor Atmore. Thank you for the presentation. If he can just give an indication to us, or perhaps submit his report to us and submit the details on his request and the research what was done to determine the funding needed for social development as he has requested. Thank you very much.
We still have a minute, just over a minute of the DA's time. I'll then see Honourable Allen.
Thank you, Chairperson. I am partly covered by Member van der Westhuizen, but in terms of the art input that we have received, I do know that the call is closed for the COVID relief funding, but I would encourage any artist and organization dealing with artists to apply for the annual arts funding, which is managed by the Western Cape Arts and Culture Program. And I would be more than happy to obtain information from our procedural officer and then make contact with the artists and the organizations that gave input today. Thank you.
Thank you very much, Honourable Allen. We then move on to the ANC, and I see Honourable Dugmore's hand is up. So I'll hand over to you, Honourable Dugmore.
Thank you very much, Chair. And thank you to everyone for the presentations. It's really been very informative, getting a sense of the issues of concern as the ad hoc committee had asked the public to provide. Just in regard to, firstly, Professor Atmore, once again, thank you for the submission. In the document, the professor refers to the survey that was conducted in April, which was obviously, you know, at the time of, one could say, the hard lockdown, and obviously there were hugely alarming stats emerging about the number of ECD centres that essentially were closed, and the numbers of parents who'd stopped paying fees, etc., and that research was done by Bridge. I just wanted to ask, has there been any more recent research? It would be really absolutely critical for us and the relevant departments to get an understanding as to, in terms of where we are now in September, have these figures improved at all? Is there more updated research? So that's the one question to Professor Atmore. And then I have full sympathy for the view that, you know, one of the major challenges faced is those ECD centres which are not accredited, and there's a strong case being made here for particular allocation to be made even to those ECD centres that are not accredited. I would just like to ask if is there actually a database of those ECD centres that are not accredited? The numbers are being referred to here because I would imagine that social development in the province has a list of those that are accredited, and they would be receiving the subsidy. I understand the motivation around a one-off grant, even for the non-registered, but is there a database in that regard? And then both to Doreen Gora and Lucas Munting, in terms of preparing for better, how would you summarize the proposals to make sure that there is more effective oversight in regard to those detained. What would you propose? God forbid that we did move to a second lockdown, but what would the key essence of your proposal be? And then to Speaker from Elita Labantu, just in terms of going forward.
Please, Honourable Dugmore.
Yeah,
thank you.
Thanks. The last question: what is your view on the universal basic income grant as one way of contributing towards food security? Are really supportive of the other measures, but what is the organisation's view on the basic income grant? Thank you.
Thank you. Right, we then, the EFF is not in the meeting today, so then we'll, I'm not sure, if Honourable Heron from the Good Party, are you still with us?
Yes, Chair.
Okay, if you have any questions, please proceed.
Yes, thank you. My questions are regarding the presentation we received on the ECD sector. I think starting is, it's obviously alarming to hear comments like that the ECD centre is devastated and that there's no solution for young children. And I think that as a committee and as a parliament, we need to address those comments and those concerns. They are quite alarming. My first question is with regards to the Restart Subsidy that was mentioned. I'd like to know what sort of amount are we talking about per ECD centre for a Restart Subsidy? And then with regards to the impact of the lack of funding on ECDs, what has been the impact in terms of, have these ECDs opened without PPE because they didn't receive sufficient funding for PPE and they didn't have their own resources? So had they not opened, or did they open and take risk? So if we can understand what the Restart Subsidy that is being proposed for the 2,000 poorest ECD centres in the province, what is that amount? And what has been the impact for those ECD centres that have insufficient funding for PPE? Did they reopen and take risk, or did they just stay closed? Thank you.
Thank you, Honourable Heron. I'll then recognise the ACDP.
Thank you, Chair. A lot of questions were asked on particular matters, so I'll just ask a question to Forza, representing so many 18.5 million people in South Africa. And I've read the recommendations, and I also think it's bizarre and unfair that certain businesses can occupy 50% of their space, and yet when it comes to churches, you get big and small, and even the biggest church or the biggest mosque or whatever, a religious facility, is only allowed to allow 50 people in the facility. So the question is, did you, and I want to say I appreciate all the presentations from all the organizations. I think it's good, but as I said, some of the people have already asked the questions, but for Forza, did you engage the Premier of the Western Cape, or I know that Dr. Ivan Meyer was also busy with religious organizations. Did you engage the Western Cape government on these issues? Because I want to agree with you. I believe it's some of the regulations is bizarre, it's irrational. But I think as a province, I know that there is a regular basis where the province have discussions nationally, and I know that the Premier said that they have influence national to change certain things. So I would think that maybe that is maybe one avenue that you will look at in order to be fair, because as I said, there's churches that can take 2,000 people or 5,000 people, and they only allow 50 people. And we know, we agree it must follow all the guidelines and all the health measures must put in place. But I think churches can manage it, mosques can manage it, and we're talking about the entire religious fraternity. Thank you, Madam Chair.
Thank you, Honourable Christians. It seems that the Freedom Front Plus is also not in the meeting today. So we will then move to the answers. We might have time for a second round of questions. And there is a question for each of the participants here today. So I'll recognize you in the order that you presented, starting with you, Professor Atmore.
Good afternoon. Thank you to the honourable members for those questions. I'll take them in the order that they came. Honourable Mackenzie, my presentation was sent to the committee. What I can also forward onto the committee is the full report from which those statistics were drawn. The Honourable Dugmore is quite correct. That was done in April month by Bridge. It is currently being replicated, so I can't send the committee an update as at August, but when it does become available, which will be around about the end of September, I'm more than happy to send it to the committee. The Centre for Early Childhood Development did a very, very brief and rapid report, which I'm also happy to send to the committee. In terms of the Honourable Dugmore's question about a database, yes, there is a database, both of registered ECD centres and of unregistered ECD centres, which the Provincial Department keeps. And again, I must say this, that the Western Cape database is by far the most comprehensive and correct one across the country. And that database can be obtained from the officials in the department. The Honourable Heron, you used the word devastated. I used the word decimated. But in fact, it's both. It's both. The sector is both decimated and devastated. So thank you for adding that descriptor for me. The Restart Subsidy, I've suggested, and it's been suggested on the basis of affordability. It is not a thumbsuck. It's based on what is needed to get an ECD centre up and running, but also cognizant of budget constraints and the times that we live in. And my professional opinion was that 20,000 Rand will see a centre able to open, purchase PPE, and have sufficient cash flow in order to buy those first meals for young children. I think the impact of, and again, the Honourable Heron asked, what did centres do? Did they just open? The answer is about half of the centres managed to open, and they scratched and they got funding from a variety of sources. A number who we work with took overdrafts at the bank. Others borrowed money from family. So how they got through it is basically by borrowing, and that was in order to buy the PPE, because the High Court ruling in the Gauteng High Court on the 6th of July said that ECD centres can open provided that they maintain all the health and safety protocols. The other 50% of ECD centres, according to our survey, simply did not open. The Western Cape Department of Social Development has come to the party, as I said, and they've made 10.2 million Rand available for PPE. If you divide that by the number of centres that they require to be reached, it's about 4,000 Rand per ECD centre. Now, you know that a thermometer, the one that gets pointed at your forehead, those cost between 600 Rand and 900 Rand. And that takes up the bulk of that PPE allocation. The rest goes on sanitizers, on materials, paper towels, etc., face masks and face visors. It's totally inadequate. And that's the point that I was trying to make, that whilst the Western Cape has been the leader in making PPE funding available, it is nowhere near adequate. Thank you, Chairperson.
Thank you very much, Professor Atmore. I'll then move on to Ms. Hilleby. If you'd, I don't know if you'd like to respond to any of the questions or comments.
Yes, it's answers to, first of all, the funding applications. I'm not sure if they are being advertised all over the place, because I mean, I've searched for a few, and that's how I stumbled upon the medical relief. That is the only relief funding that has paid out. Every other application has, I mean, there's been no response. My husband is a musician himself, and we as a group of musicians have obviously circulated various funding applications and websites to apply and that kind of thing, and we've received no response. That's my concern, is that obviously going forward, slowly but surely, we're opening up and we're doing live streams to earn merely donations. But going forward, I mean, our debt is just increasing, our rent needs to be paid, all of those realities are just increasing, and there's nothing being said about the way forward. I believe, I mean, somebody mentioned the annual arts funding. That was something that we weren't even aware of. So where is the information being advertised or broadcasted is my question. And what is, we are not sure how long we are, like, there's no indication of how long we will wait for a response. You know, I mean, I've personally phoned one or two funding websites or offices just to merely ask whether all our applications were fine. Is there any other requirements required? I mean, we can't do that all the time. And, you know, we receive confirmation that the applications have been received, but there's no further response as to when to expect funding and how much and all of those things. So yes, we have applied and we continuously apply. I Google every day new relief fundings that gets updated, and we consistently applying for these things. We are all musicians that have had residency at various hotels and restaurants, and I mean, we earned consistent incomes, and all of that is gone. So we really desperate in wanting to know what the way forward is for us. I mean, it's not even about funding, it's just about work. We're wanting to work, we're wanting the industry to open up in some way, like there has been. I know weddings are now allowed, and we just need more information with regards to the artists. So I hope that answers the question.
Thank you very much. I'll then hand over to Ms. Ellerbeck to respond to some of the questions, please.
Thank you, Honourable Chairperson. Honourable Christians, thank you for asking that question. 4SA has engaged with the Western Cape government by submitting to this committee, and we've also engaged extensively with national government, though I would say that engaging with the Premier of the Western Cape going forward is a very good advice, and we will definitely look at that, because we do believe that the time is now ripe for the Western Cape, as having passed the curve, to move down to lockdown level 1 and utilize the differentiated alert level approach, or even no lockdown. So thank you for that. That's definitely something we will be looking at.
Thank you very much. I'll then give an opportunity to the Detention Justice Forum. I'm not sure which of the representatives would like to answer, or both of you. You're welcome.
I'll take it. It's Kristen speaking. So what should have happened was that the Judicial Inspectorate for Correctional Services visitation to conduct oversight should not have ended. That shouldn't have happened. And there is clear advice from the Special Rapporteur on Torture that is in line with the South Africa's obligations under OPCAT, the Optional Protocol Against Torture, to continue with detention monitoring, what we were expecting from them, from the NPM, which is the South African Human Rights Commission, along with the Judicial Inspectorate, was to devise other alternative methods of fulfilling its preventative mandate, or to come up with some form of innovative ways in terms of still being able to access effective independent complaint system, which allows obviously for social minimizing the need for social contact. And so the Special Rapporteur on Torture makes provision for a number of recommendations, or alludes to such as, for example, setting up hotlines, or for example, a specific coordination of posts whereby inmates' complaints could still be dealt with. So yeah, there are a few recommendations made by the Special Rapporteur on Torture. The problem was that despite our efforts to engage with the NPM on this, that they were not forthcoming on the plans that they have implemented. And so we accept that there was none at all. Thank you.
Thank you very much. I'll then hand over to Professor Munting.
Thank you, and thank you to Honourable Dagmore for the questions. I think the key issue here is, if we are looking to the future, is that we need to ensure that those facilities that are places of detention that are currently not covered through a monitoring institution need to be covered. And in that regard, the Human Rights Commission, as designated NPM, needs to show the necessary leadership. At present, it's the Inspectorate, the Military Ombudsman, IPID, and the Health Ombudsman that form the national or the constituent parts of the National Preventive Mechanism. So that needs to be expanded. I think secondly, we need to ensure that monitoring continues if there is a lockdown again. So this is a problem that must be fixed in law. To ensure that monitoring of places of detention is defined as an essential service and not only restricted to correctional or full-time employees, but also to monitors, as in the case of the Judicial Inspectorate. The third point is that there needs to be effective communication with detainees as well as their families. We received numerous issues or complaints, questions, people just literally not knowing what is going on, what is happening inside prisons, what is allowed, what is not allowed. And I think one needs to seriously look at alternative ways of communication, of facilitating visits, etc. I mean, bear in mind that we went into lockdown on the 26th of March. Visits to prisons are only now commencing again. We're talking about close on 6 months later, which must cause tremendous strain for families and as well as people detained. And then the last point is we need transparent reporting on what is happening in our various detention facilities. I think we can learn from this that it's extremely difficult to manage a disaster in the dark. We need information to inform policy, but also law reform decisions. Thank you very much.
Thank you, Prof. I'll then hand over to Mr. Monakili.
Hi. Thank you, Honourable Dagmore, for the question. And my response to the basic income grant, which the acronym BIG has been given, is the fact that it's actually going to allow for big potential within the economy and within the livelihoods of many, many South Africans. The fact is the basic income grant will allow for better financial freedom to make choices. As we've seen with our grant system, this universal income grant will give a sense of financial freedom, whereas a person can make pure decisions based on their income. That means that people will be able to make investments, people will be able to make better savings, people will be able to ensure that they can be financially versatile with their money. This will then go back into ensuring that there's lots more opportunities for people in the job sectors, and also creating a savings culture, and also a culture where we understand that the world is run on credit. And now, by people being allowed to basically showcase that they have a basic income and therefore can be able to sustain themselves through maybe getting some sort of credit, where we understand that the poverty does not only last with food, but people need roofs over their heads. They need to invest in their children's school livelihoods. They need to invest in healthcare. Those investments that they will be able to make with the freedom that they'll be given will ensure that they will be able to better live longer lives, better contribute to society, and will allow people to actually think better with their money than just think that this money is only meant for this purpose. By now diversifying the money that they will be receiving, people will be able to then make better choices with the money, and also ensure that they are contributing not only to their livelihoods but their children's livelihoods, and that in case will then grow neighborhoods, will ensure better job opportunities, and will ensure that people have now access to financial services that they would have never had before with the grant system that we were having. Thank you.
Thank you very much to all the participants for those responses. We do have time for another round of questions. So we'll run the same system again and see if other members would perhaps like to ask some questions. I then, as usual, will start with the DA. Honourable Bosman, over to you.
Thank you very much, Chairperson, and good afternoon, everybody. Chairperson, I just want to direct one or two questions to Dr. Atmore, Professor Atmore. Just in terms of the ECD centres, if the Professor could share with us what his thoughts are on the National Minister of Social Development's proposal for ECD compliance monitors, and what he thinks of that plan, especially the amount of money that's been budgeted for it. And if Dr. Atmore could also tell us if any of the organizations working with the Centre for Early Childhood Development has benefited from the National Vangasali program in terms of getting unregistered ECDs registered. And then if the colleagues could also perhaps tell us what the impact of the temporary social grants have been on food security and whether that has helped. Thanks, Chairperson.
Thank you very much. Any further questions from the DA? A few seconds left.
Yes, Chairperson Ricardo Mackenzie.
Thank you.
Chairperson, yes. Professor Atmore, we did receive your submission. Thank you very much. And as Member Darkmore has asked, what I was also looking for was the latest one, which research that were done, which you've partly answered. And then just on the, because it is, as you say, I mean, it's a serious problem. What, except for providing funding, has the Early Childhood Development Center perhaps look at alternative model in dealing with ECD centers? Because a lot of them, as you say, provide an incredible service in our communities. And then secondly, Chair, my chairperson would be to Ms. Vega. Except for the funding from application they've done with the department, has the National Lottery, have they been of assistance to the artists, particularly in the Western Cape? Because we've seen that with recent reports that given the National Lottery has given funding to some police station in the Northwest and things like that. Has the National Lottery reached out to artists in the Western Cape, or did the established industry in the Western Cape to see how can we assist you during this difficult time? Thank you, Chair.
Thank you very much. Any final questions? If there are none, I'll then...
Chair, sorry, Chair.
I was still recognizing DA members. Still have 30 seconds left. But if there are none, then we'll move on to the ANC. I'll see you, Honourable Dugmore.
Thanks very much, Chair. Chair, I'd just like to, in terms of the proposal that's been developed by Professor Atmore, I understand the proposal for the once-off grant of 40 million. I think he's explained, you know, the need to get the ECD centres going, the issue of PPE and so on. But just in regard to the 450 for the ECD subsidy, is the proposal there that that this amount would actually then become, I presume this is not a one-off grant, this is actually a proposal that is being made to cover registered and non-registered centres so that they are both able to receive subsidies. And then just to ask, you know, there is a discussion at the moment at NEDLAC around measures to boost economic growth and employment. And I know that there is one component of that is, you know, injecting funds into public works programs, you know, at a national level. Now, it would seem to me that there should also be an opportunity in regard to the ECD sector, given the absolutely critical role that it's played and the crisis that it faces at the moment. Are you aware of any discussions happening where this sector, in terms of those ECD practitioners at the registered and unregistered sites in terms of subsidies, are you aware of any discussion happening at that NEDLAC level around support for this sector? Thanks.
Thank you, Honourable Dugmore. I then recognise the Good Party.
Thank you, Chairperson, and thank you to the Professor for the answers. I have a few follow-up questions. I keep hearing about this proposal, and I don't believe that I've seen the proposal, but does the proposal include a request for this funding? And do I understand the funding request correctly, that it's 20,000 Rand per ECD centre that is financially constrained, and that would be about 2,000 centres, so that's the 40 million. Now I can't read my own writing. I wanted to know, does the Professor have any idea how many ECD centres did not reopen and how many children were impacted by this? Thank you.
Thank you, Honourable Heron. I then see the ACDP. Any final questions from you?
Yes, Chairman, thank you very much. I also just want to, again, just talk about the ECDs. The Professor mentioned, you know, of how many children were at home and vulnerable, vulnerable at home and not receive the meals. Can you maybe just tell us, you know, is there statistics available? Were there reported cases? I know that many of our children are safer in the ECDs than at home. Did they receive statistics of what happened with these children, where children were not fed? What's the comeback? And you know, were there reported cases of child abuse and those type of things? Because it's very concerning, Chair, and I think this is really a sector that we must look after and assist where we can. But it's alarming, the figures, you know, ECD does a credible job. And how many of those centers has been closed and parents must go work and leave when the level lockdown, you know, became a 4 or 3, and those children, they've, you know, if they're not in the ECDs. So if you can just give us something on that background, what happened to the vulnerable, especially the vulnerable children? Thank you, Chair.
Thank you, Honourable Christians. I'll then hand over to the participants. I'll start again with you, Prof. Atmore. Apologies, before you do, I see Honourable Mackenzie, you have your hand up.
Chairperson, can I just ask one qualifying question, please, just to make sure that I answer ask the question properly so Professor Atmore can understand it. What I'm trying to ask Professor Atmore, if you, for example, talk about, Member Darkmas asked, the 20,000 Rand, if Auntie Sue Maya in Tafelsig works from her home, she doesn't have a double garage, for example. She literally got children in her lounge and somebody else with it. Has there been discussion? Is that amount infrastructure related or purely just for PPE? And has the discussions been around the city of Cape Town? And that's why I'm asking for the research document, just to see what level of detail was done to determine that amount. Thank you.
Okay, thank you, Honourable Mackenzie, for the clarification. Prof. Atmore, over to you, please.
Honourable members, thank you for those follow-up questions. I'm going to take them in the order that I received them. The Honourable Bosman, the National Department of Social Development and the Social Development Minister have acquired 1.3 billion rand from the President's Fund. They want to spend this on employing 36,000 young people to ensure compliance of ECD centers. This has been wholly, totally, and vigorously rejected by the whole ECD sector. And when I say that, I speak from 4 decades of working in the center. I have never seen a sector so cohesive and so singular in their opposition to that. The National Minister wants to employ 36,000 young people to police ECD centers to comply. Whilst doing that, 180,000 jobs, the overwhelming number of whom are women, are at risk. The ECD sector came together under the COVID-19 Civil Society Coalition, and an early childhood development group was initiated. There was a week-long protest across the country where tens of thousands of people protested. There was 2 petitions, one of 5,000 signatures, one of 11,000 signatures, and that proposal was wholly rejected. What we are not saying is that compliance is not important. Compliance is very important. We're saying that in the midst of a pandemic, compliance must be put on the back burner, and we must save those 180,000 jobs and ensure that 2.5 million children can access a quality ECD program. So that's the big picture. Compliance is important, but it is wholly inappropriate to do it at this point. Save those jobs, get those ECD centers up and running, and then we can get on to compliance. There is a second court case, and remember, the National Minister did not open ECD centers. She refused to, and it took a High Court decision to force her to open ECD centers, provided that the centers had all the protocols in place. So that's the big picture about the 1.3 billion rand. On Vangasali, Vangasali is pretty new. At the moment, it is simply capturing data. Not one ECD center has been registered as a result of Vangasali. Vangasali is a campaign of the department together with the Nelson Mandela Foundation to get ECD centers registered. The problem with registration is that it's not that the centers don't want to get registered. It's that the cost of getting registered is so prohibitive. You now need building plans, you need rezoning, you need zoning approval. This costs 50,000, 60,000 rand just for those documentations. And poor, vulnerable ECD centers in Delft, in Umpleni, in Orange Farm in Gauteng, in Botshabelo, they cannot afford to register. So there's this misconception that ECD centers don't want to register. Nothing could be further from the truth. They cannot afford it. I can't recall the third thing. I scribbled it down here. I can't recall what it was, Honourable Bosman. Maybe it'll come back to me. Honourable Mackenzie, yes, there are alternative models. I want to state for the public record, and I've said this publicly for 5 years now, the National ECD Policy, the National Integrated ECD Policy, which Cabinet approved on the 15th of December, on the 9th of December 2015, is outstanding. It is a brilliant policy. It is world class, and it's probably amongst the world's best ECD policies. However, it will not be implemented without the political will to drive it. And political will is most often measured by the resources that are allocated to a particular activity. The policy will not be implemented unless there's a substantial increase in funding resources going to ECD centers. Some of these alternative models, which the Honorable Mackenzie may be referring to, are playgroups, parent education, home visiting programs. These all exist in abundance and very, very good conceptual models as well. The second part of Honorable Mackenzie's question is about the 20,000 Rand proposal that I've made, which I've made to National, by the way. It is not infrastructure related at all. It is simply operational. It's to enable ECD centers to restart their program. Infrastructural costs will cost many, many, many billions Rand more. And we are sufficiently realistic to know that this is not the time or the place to be asking for infrastructure funding. We have to get the centers up and running, open and up and running, so that young children can enjoy the benefits. The Honorable Dugmore, the 20,000 which I'm suggesting is a once-off. It's not per month, it's not per annum, it's a once-off restart grant. And if you multiply that by the number of ECD centers and you add in the PPE allocation which I've suggested, it comes to 490 million Rand. I'm not aware of any ECD discussions at NEDLAC. That's not to say that they aren't happening. They may well be happening. I'm just not aware of it. The Honorable Heron, the paper that I submitted to the committee includes all the details. Only 40 million of that 490 million is for PPE, because there are two components to getting an ECD center up and running. The one is the PPE, which is a legal requirement following the High Court decision. And the other one is the operating costs to purchase food for young children. I'm not sure if it was you or another honorable member whose name I didn't get, who asked about how many centers opened. Our rapid survey, and it's not a representative survey in the sense that it was done very quickly, but we surveyed 150 ECD centers along the South Peninsula Belt, which is Retreat, Lavender Hill, Sea Winds, and also out towards Philippi, Guguletu, and Khayelitsha. And half of the existing ECD centers in the province, there are about 4,500 on the Social Development Provincial database. Half of those are not open. That's about 2,300 ECD centers are not opening or have not yet opened. The honorable member whose name I didn't get asks, what happens with children? Well, those children are on the streets, and it's been reported anecdotally. It's been reported by both the police and by medical practitioners, specifically Red Cross Children's Hospital, that more children are being victims of crime, abuse, neglect. So it really is as the Honorable Heron said, a devastating situation that we're in. I hope I've covered everybody's questions. If I haven't, it's not that I'm avoiding it. I'm not sure that I wrote it all down. Thank you.
Thank you very much, Professor Atmore. Were there any members' questions to the professor that still need to be answered? So it seemed you've answered all the questions, Professor. Thank you very much. I think the easiest would be if I would just, give each participant an opportunity to see if they had any responses, or would also then, if they didn't have the questions directed towards them, if they'd like to make any final comments. I then see Ms. Hilleby.
Yes, thank you. No, I'm fine. I'm fine for now. I've answered and I await responses, but I'm fine for now. Thank you.
Thank you. Then Ms. Ellerbeck.
No, fine from my side. Thank you, Chairperson.
Thank you. Then either Ms. Gora or Ms. Peterson.
Hello. Yeah, I think we're fine as well.
Okay. And then Prof. Munting.
I'm good, thank you, Chair.
Okay, perfect. And then Mr. Monakili.
Yes, I would just like to respond with the question that was raised in regards to the 350 Rand social assistance that has been given from government. Basically, the assistance has been greatly received where it has worked. The issue that we will continue to see is the fact that it doesn't reach all the hands that it needs to reach. We are still striving to ensure that people still have access to all forms of government assistance, as the fact is food security still remains a major issue. The 350 has helped many families be able to pay for their electricity, water rates, and get their basic amenities. But when it comes to issues of food, sometimes food has to take a back burner because you don't want to lose your home over the fact that you can't eat. So those are the type of sacrifices being made in many homes currently, where people have to decide on what is more important. And therefore, the issue of food security will still be something that's pretty relevant within our society for quite some time. And that's why we still need to ensure that many organizations are supported, because at a grassroots level, we have to ensure that especially those women and children are supported in any way possible. We've seen how with the lockdown and the regulations that have been in place, how food has become the #1 priority in many instances. And we shall continue to ensure that we serve those communities at grassroots level throughout the Western Cape, because we understand that the need is much greater than what is officially out there. As you Benny, have seen that food prices have increased. A lot of the basic needs that a lot of communities need, people have to go far and wide to access them. I'm not talking about within only the urban area, but I'm talking about the rural areas where you don't have access to major retailers, and people have sought to just depend on what is mainly your spaza shop, which has markups of up to 30 to 50% on products that you can find at major retailers at a reasonable price. And those people now have had to depend on those services of these spaza shops to ensure their own livelihoods. So it is something, food relief is still going to be an issue that we're struggling with. But we just have to ensure that we keep trying to push people in regards to educating themselves on food security, nutrition, and also sustainability and self-regulation in regards to food wastage and what is basically good food for people. So the 350 Rand assists, but it assists in only a certain way, and it hasn't assisted in every way possible. Thank you.
Thank you, Mr. Monakili. That then concludes the public engagement portion of our meeting. I'd like to thank each of the participants. I'd like to thank you, Professor Atmore. I'd like to thank you, Ms. Hilleby. I'd like to thank you, Ms. Ellerbeck. I'd like to thank Ms. Gora and Ms. Peterson. I'd like to thank Professor Munting and Mr. Monakili, who've all put a lot of thought and effort into their submissions to this committee. We've heard about difficulties. We've certainly gained some very interesting insights on the various themes that this committee has been looking at. And this helps us to put a better picture together of the impact of this pandemic on our society in the Western Cape. And it helps us to formulate recommendations as a committee and hopefully to be able to assist where we can. So we'd like to thank you very much for your time today, and thank you very much for your submissions and for responding to our questions. We're very grateful for you. So thank you very much for that. I would then ask the members if you could stay on the line. We're going to have a look at our public participation grid and how we deal with the public submissions that were received in writing and on WhatsApp. And then we also have some minutes to adopt. But I think before we move into that second part of the meeting, let's take a short break and reconvene at 3 o'clock. Resume this ad hoc committee on COVID-19. Thank you very much, members, for staying on the line. The next part of the meeting is going to be consideration and deliberations on our grid of public participation, and then we also have some reports and minutes that we need to adopt. So onto the grid of public participation, you will recall that the committee came to agreement on a set of questions. Those questions were then translated into all 3 languages of the Western Cape. Adverts were placed in the traditional media, as well as a social media campaign which was launched. That public participation process has closed, and we received just under 17,000 submissions. So it was a very popular public participation program. And now we have to look at a way to deal with the very vast amount of submissions that we received primarily via email and WhatsApp voice notes. So what I'm going to propose to the committee is the following. I think if we as a committee meet as we are to deal with all 17,000 submissions, it's going to take us a very long time to do so, if not months. So what I would like to propose to the committee, and I hope that you'll agree, is that we divide ourselves into working groups, and then each working group would deal with public submissions and then report back to the ad hoc committee. So I'd then like to propose that we divide the permanent members of this committee, of which we are 15, into 5 working groups of 3 members each. And then each of those working groups will meet, and I've set aside 2 dates, on Thursday the 8th of October and Friday the 9th of October. So there are 2 consecutive days so that everything is still fresh in members' minds, which gives 6 hours for those members to work through the submissions. Some groups may be faster and may not need the second day. Others might use the full 2 days in order to have a look at those public submissions. So first of all, is everyone in agreement that we divide ourselves into working groups to deal with the public submissions?
Agreed, Chair.
Support, Chairperson.
Thank you very much. I just think that this would be the most practical way to do it. So if we divide into 5 working groups of 3, a procedural officer will be assigned to each of those working groups to assist with the work that needs to be done. And then we would ask that each working group submits a short report of their findings to the ad hoc committee. And then that will take place on Wednesday, the 14th of October. So those 5 groups will then report back to the ad hoc committee and table it at the full ad hoc committee on Wednesday, 14th of October. And then formal decisions will be made by the ad hoc committee based on the feedback from those working groups. So I've just I've taken the permanent members in no particular order, or actually I started in alphabetical order, and put together the 5 groups. So in group 1, it would be myself, Honourable Dugmore and Honourable Christians. Group 2 will be Honourable Mitchell, Honourable Allen, Honourable Heron. Group 3 will be Honourable America, Honourable Philander and Honourable Trejo. Group 4 will be Honourable Bartman, Honourable Windvogel and Honourable Lekker. And group 5 will be Honourable van der Westhuizen, Honourable Bosman and Honourable Murray. And in that way, the permanent members are all assigned to a group, and then the alternates can join the working groups that they choose, either group 1, 2, 3, 4, or 5. I will ask the procedural officers to circulate then the working group schedule so that you all know who you're in a group with. And then we'll put into the parliamentary program that the groups are meeting on the 8th and the 9th of October from 2 till 5. Okay, great. I'm glad everyone agreed to that as a workable course of action. Honourable Lekker, I see your hand.
Thank you, Chairperson. Good afternoon, everybody. I'm just checking, Chair, if it's possible, because I'm struggling to make copies of today's presentation here. If it's possible that the staff members can arrange for a badge for me, please.
From today's meeting?
Is that correct? Of today's presentation, Chair.
Okay, perfect. I'm sure they're listening in. Then what I'm going to do is ask one of the procedural officers if they could flight a matrix of the master one, just so that you can have a look. The matrix has been prepared, which was a mammoth amount of work. And then each group will get a portion of the submission. So it will be approximately 3,500 submissions that each working group will need to deal with. Okay, can everyone see that? Okay, so here is the matrix of the submissions received. So every group will receive something like this to work through and in order to put together a report that we can then deliberate on. Excellent. Are there any questions? Just to note then that the 5 groups will be meeting simultaneously. So the working groups, those sessions will not be broadcast. Those are considered working or workshop sessions of the committee, but the report back to the formal ad hoc committee will of course be broadcast. Okay. Honourable Murray.
Thank you. Sorry for being late, but I did make an apology. Okay. What are these committees supposed to look at the submissions? Will it be a subjective report back or objective report back? We're from different political parties. How's this going to work? How are we going to report back to the main committee on what issues and in what form?
Yeah, well, thank you for that question. I'll leave it to each group to determine. You could, for example, say the working group received a majority of inputs concerning, using today's topic, early childhood development. The main concerns were X, Y, and Z. So, I mean, we'd want it to be absolutely objective, so that that report is a reflection of the inputs received from the public. In a summarized version, and that will then come back to the formal ad hoc committee, where all political parties and all members represented in the committee can then hear the objective summary from those working groups, and we can then put it together as part of our report and make some or at least deliberate on it in how we take it forward as a full committee. Honourable Lekker, is that your hand again, or is that from earlier? Okay, so from earlier. All right, are there any other questions on the working groups and the working group system? None? Great, thank you very much, members. All right, so you'll all receive a notice of meeting for those working group sessions on the 8th and 9th of October. If we could then move on with our agenda. If there are any resolutions or recommendations or requests for information stemming from the submissions we received today, if those could please be submitted in writing by 12 o'clock on Monday. And then we have our activity report for July that we need to adopt, and I'll ask if that could please be screened. Sorry, Honourable Marie, I neglected to mention that for the working groups, we will provide a template to assist the working groups. And so that we also have some form, nominal amount of uniformity between the reports.
Thank you.
Okay, so here we go. This is report 4 of this committee, and it deals with the work of the committee in the month of July. Page 1. This is the membership of the committee and support staff. Page 2 is the introduction and background. The election of chair. This is, appears in every report. Okay, then we move on to the themes covered in July. Page 5. Page 6. Page 7. Page 8. And the final page. Are there any edits or amendments to the committee's report, please? None. Can we then move to adopt the committee report?
Yeah, excuse me, was this previously circulated, or do we see it for the first time now?
This was previously circulated. Can I just check with the procedural officer when it was circulated?
Good day, Chairperson. It's Lizette. Can't give the exact date, but we circulated this in August, and Zahida again last week circulated this to members.
Thank you very much. Okay, so it's been circulated twice. Okay. Are there any edits or amendments to the report? If there are none, can we adopt the committee report, please?
Propose, Chair Derek, that we adopt the report.
Thank you,
I will
Honourable.
second.
Sorry, I didn't hear who the seconder was.
Westhuizen.
Thank you, Honourable van der Westhuizen. Thank you for seconding the report. Excellent. Let's then move on to our minutes of the 17th of July. These are standing over from our previous meeting. We didn't have time to get to them. This was on the theme of citizen surveillance. It's from the National Department of Health. Okay, and you can see the resolutions. Okay, right. If there are no edits or amendments, can we proceed to adopt the minutes of the 17th of July?
Yep.
Thank you, Honourable Mackenzie, and thank you, Honourable Philander. Thank you, Honourable Philander, for seconding. All right, then let's move on to the minutes of the 22nd of July. All right. If there are no edits or amendments, can we move to adopt the minutes of the 22nd of July?
Moving for adoption, Chairperson, Wendy Philander.
Thank you, Honourable Philander. Could I have a seconder, please?
I second that, Derek America.
Thank you, Honourable America. The minutes are duly adopted. We then move on to the minutes of the 19th of August. Okay, this was the health update and the theme on schooling and education. Please check attendance.
Chairperson?
Yes, Honourable Mackenzie.
The minutes is right as they are. Obviously, we did receive the report subsequently. Are we going to include that in the resolutions of this meeting? Like 5.1, 5.1.1, we did receive the reports after the meeting, obviously.
After the meeting. So we have to reflect in these minutes as it happened on the day. But yes, I thank you for reminding me. I'll just table that so that it forms part of the minutes of today's meeting.
Yes, okay.
Okay, all right. So can we then adopt the minutes of the 19th of August as they are?
Adopt, Chairperson. Other questions?
Thank you, Honourable Christians, and thank you, Honourable Mitchell, for seconding. Right, then let's move on to our final set of minutes that we need to adopt today, and that's the minutes of the 26th of August. Okay. If there are no editorial amendments, can we move to adopt the minutes, please?
Chairperson?
Yes, I support.
Thank you, Honourable Doug Moore and Honourable America. Sorry, I neglected to include the minutes of the 14th of August, and that really will be the last set of minutes today. All right. If there are no editorial amendments, can we move to adopt the minutes of the 14th of August?
Yes, we can.
Thank you, Honourable Mackenzie. May I have a seconder, please?
I second. Van der Westhuizen.
Thank you very much, Honourable van der Westhuizen. All right, thanks very much, members. We've then dealt with the minutes that needed adopting, a large number of them. And then just to note that we have, and you have all received the input from the Wellington District SGB that as was undertaken in the meeting, they did provide the committee with their input. Honourable Mackenzie.
Yes, Chairperson.
You have your hand up. Was that for minutes?
Oh, sorry, no, that was from earlier on, sorry.
Okay, perfect. Okay, all right, then if there's no other business, that then concludes the meeting of today. Thank you very much, members, for your participation and asking all of your questions, as well as assisting to get the work of the committee done. So I wish you all a good afternoon. Further communication. On that note, then I will adjourn the meeting. Thank you very much.